Hey guys, welcome back to my channel, The ENT Resident. Today we'll be talking about some basics about rhinoplasty. We are going to be talking about what is rhinoplasty, what are the indications and contraindications of rhinoplasty, and what are some principles that we follow during rhinoplasty. You can also now purchase my notes. I've added links in the description. Okay, so let's get started. So, first of all, what is rhinoplasty? So, we all know, like, very commonly, we refer to rhinoplasty in common man's term in the form of nose jobs. So, basically, what rhinoplasty is it's a surgical procedure which is performed to alter the shape, size, contour, or function of the nose, mostly for cosmetic improvement. So it is basically most of the times a very cosmetic surgery that is done electively to alter the shape, size, or contour of the nose. Now, sometimes we combine rhinoplasty along with septoplasty to address the deformity which is there in the external nose, as well as the in the internal nose, maybe in the form of a septal deviation. When these two surgeries get combined, in that case, we call it as septorhinoplasty. So this is what rhinoplasty is. It is nose job. Basically, we are altering the shape of the nose for cosmetic reasons. Now, what are some indications of rhinoplasty? So whenever we are asked about the indications of rhinoplasty, we will first classify the indications into four types. We have the cosmetic or the aesthetic indications. Then we have functional indications. Then we have reconstructive indications, and lastly, we have some revision surgeries. So we'll talk under each one of them. So first of all, talking about the cosmetic or the aesthetic indications. Now, the prime purpose over here is basically to improve the aesthetic appearance of the face. Now, let's talk about some examples of such cases. Maybe the patient has a nasal hump deformity. So, if you look at the dorsum of the nose, the patient can have either a bony hump, which is involving the bony vault of the nose, or a cartilaginous hump involving the cartilaginous portion of the external nose. Now, to know a little bit more about the anatomy, the surgical anatomy of the external nose in relation to rhinoplasty, I have a separate video where you can check that out. But if we have a nasal hump deformity, we can have two types. One is a bony type, which is involving the bony vault, and one is a cartilaginous type. Second, if the patient has a broad or a very wide nose, maybe they have a wide nasal bone, or maybe they have a very wide alar base. In that case, also it is an indication for rhinoplasty. Maybe the patient has a deviated or a crooked nose. So, any kind of external nasal deviation which is causing a cosmetic disfigurement to the patient. Any kind of nasal tip deformity. Maybe the tip is poorly projected, under projected tip of the nose, or even over projected tip of the nose, or the tip is rounded, bulbous, or boxy. Different kinds of tip deformities can also be improved with the help of rhinoplasty. Then we have the over projected or the under projected nose. Here, maybe the nose is either excessively long or excessively short in relation to the other facial features. I've spoken about in my previous video where I spoke about the preoperative assessment. I have spoken about how do we assess this? How do we understand whether the nose is over projected or under projected? What are some nasal tip relationships that we look at? These are all things that I have covered in a separate video. You can check it out over there. Then maybe a patient with a saddle nose deformity where we have a depression of the nasal dorsum giving a very concave profile appearance. Maybe the patient has a wide or a flared ala or asymmetrical nostrils or a hanging or a retracted columella. Now, a columella that is either excessively visible or retracted. To assess this, we look at something which is known as the columellar show. This is something I've discussed in the preoperative assessment class. So these are some examples of cosmetic or aesthetic indications to perform rhinoplasty. Now, rhinoplasty is not just performed for cosmetic reasons, but sometimes there can be functional reasons as well. So, the functional indications are primarily to improve the nasal breathing of the patient. So, if there is an external nasal deformity which is causing nasal obstruction, that will become a functional indication. So, if a patient has a DNS, a deviated nasal septum, along with the external deformity of the nose, that will be a functional indication. If the patient has nasal valve collapse or a post traumatic nasal obstruction or congenital deformities which is causing airway compromise, these would comprise of all the functional indications to perform rhinoplasty. Next, we have the reconstructive indications, meaning where we are trying to restore the normal anatomy of the nose of the patient. Now, this is usually happening maybe in a case of trauma, a post traumatic deformity, or maybe the patient has had a large tumor excision, leaving behind a defect in the nose or the area around the nose. Or also patients with congenital nasal anomalies. So, in all of these cases, we'll have to restore the normal anatomy of the nose. So, all of these cases will comprise to form the reconstructive indications of rhinoplasty. And lastly, we have revision surgeries. Like, for example, a patient has already undergone a previous rhinoplasty, but they are not satisfied with it, or the results are not good. In that case, correction of that will also be an indication. Or if there is a persistent deformity or obstruction even after an earlier surgery. So these are all our indications. We have classified them under cosmetic, functional, reconstructive, and revision indications. So these are the indications. Next, moving on, we'll talk about the contraindications of rhinoplasty. Now we have some absolute contraindications and then we have some relative contraindications. First, talking about the absolute contraindications, if the patient has any kind of uncontrolled systemic illness, maybe they have uncontrolled diabetes mellitus or CKD or hypertension. These are all patients who are unfit for surgery or even for taking up under anesthesia. So, first, you should be controlling the disease, the systemic disease itself, before you take the patient for surgery. Second is if the patient has an acute respiratory infection like an acute sinusitis or rhinitis. Because this is most of the time rhinoplasty is an elective surgery, so it is preferable that you first control the infection before you take the patient up for surgery. So acute respiratory infection would also be a contraindication. Next, if the patient has untreated psychiatric illness or body dysmorphic disorder. So I've spoken about in the preoperative assessment of rhinoplasty that in your initial consultation, it is very important to understand the motive of the patient behind asking for the surgery. What are they expecting from you? Are their expectations realistic or not? Are they asking for too much? Maybe they have a very minor deformity, or maybe they have body dysmorphic disorder. Maybe they have personality issues which they attach to the appearance of the nose. So, these are all cases which can be very difficult for you to treat. So, a psychological assessment of these patients would be required before you take them off for surgery, or even if you want to take them off for surgery. So, untreated psychiatric illness or a body dysmorphic disorder ends up being a contraindication here. Another absolute contraindication is an active pustule or infection in the operative area. So if this is the case, then we defer the surgery until the situation is completely resolved. Next, moving on to some relative contraindications. If the patient is very young, we have to wait for the nasal growth to be complete. Before the nasal growth is complete, if you perform a rhinoplasty, it will affect the development of the nose in itself. So we have to wait before the nasal growth is let the nasal growth complete completely, and then we'll take the patient up for surgery. Second relative contraindication is if the patient has acne, thick, and oily nasal skin. I've spoken about in the preoperative assessment class that the quality of the skin matters a lot. If the patient has an acne prone skin, and if they have very thick skin, oily skin, these are very difficult to deal with. They may not respond well in terms of healing after rhinoplasty. So these are cases that may be a relative contraindication. Third is bleeding diathesis. If there is any history of abnormal bleeding, you should first investigate it and try to treat the situation before you take them up for surgery. If the patient has diabetes or poor wound healing, this will affect the outcome of your surgery. So this is another thing to look at. And lastly, there are some psychological contraindications like patients who have minimal or imagined deformity or who have unrealistic expectations, psychologically disturbed patients, patients who are already involved in litigation. Maybe you don't want to take those cases up. Indecisive male patients, usually it's been seen that male patients are much harder to deal with, and they become more problematic in these cases. Also, emotionally unstable or hysterical individuals. So, these are all the contraindications that we should be aware about when it comes to rhinoplasty, and these can all be dealt with in different ways before you decide whether you want to take the patient up for surgery or not. Lastly, last section for today is to discuss a few principles that we need to remember when we are performing rhinoplasty. First principle is we should be very conservative in the resection of various parts of the nose to get the maximum benefit. We should be very careful not to remove tissue aggressively. Be conservative in our approach. Only remove what's absolutely necessary. So, this is our first principle. Be very conservative in our approach to dissecting tissues out and try to get the maximum benefit out of minimum removal of tissues. Second is correct what is appearing unpleasing and try to preserve what is pleasing. So try to identify first the specific deformity that is troubling the patient aesthetically. But if there is a deformity which is already harmonious and very pleasing in the nasal anatomy, and you do not think it is a deformity, maybe you should not be disturbing that. And secondly, you should not be doing rough handling of tissues over here. You may end up causing a scar or bad healing in these cases. So, only correct what appears unpleasing and try to preserve what is pleasing and normal anatomy. Third is you should know where to stop at each surgical step. So just because something is mentioned in the textbook like these are the steps does not mean you have to follow that exactly and remove off all excise tissues which are unnecessary, which is not required in your case. So you have to be very conservative in each surgical step that you are following. Try to you have to personalize it, customize it according to the patient's need, what they require, and not just blindly follow the book and excise of normal tissues. Next principle is never promise to the patient miraculous results after surgery. Should discuss with the patient every detail and aspects of rhinoplasty, including what are they going to face post-operatively, what kind of swelling and edema may occur, and what would their healing pattern, what are the possible healing patterns that may look like. So you have to discuss all of these details and give them a very realistic expectation of what will improve and what will not improve, instead of giving them miraculous hope that they are going to get the perfect nose. Maybe you give them a more realistic expectation by having a proper discussion with them. Lastly, beware of psychotic patient. I have mentioned multiple times in my preoperative class that selection of the rhinoplasty patient is extremely important. Here, you as a surgeon have to safeguard yourself by paying attention and care to the problem patient categories that I have mentioned in the video over there before you make the decision to take the patient up for rhinoplasty. You may end up in litigation or you may end up in a lot of trouble if you have not done this correctly. So that's all for today. In my next class, I'll be talking about the different types of rhinoplasty. See you in my next class. Thank you.